From KOAT Action 7 News, this is breaking news.
It has been a while since we have heard from Governor Michelle Lujan Grisham about the COVID-19 cases in New Mexico. She is holding a live presser update in Santa Fe. Let's go there live.
In the state. This particular New Mexico Pride mask was made by Jilly Oyenke, and she is a member of IATSE, that local union, and works, as many of you know, the film industry is a place that she does incredible work and leadership. So Jilly, thank you very much for this mask. It means a lot to me, and I wear it and it keeps me safe, and I appreciate that, and it makes sure that I am keeping my colleagues as safe as I can. So we're going to start in the same way that we have been. This one's going to do this press conference update. We want to make sure that we're talking about our next phase of plans and talking about where we head this summer, and to give people a sense about, I promise that, and we've been modeling and looking at data every day and tracking our cases and watching how our business partners and our social distancing and isolation has really made an impact, and what else we need to do to slow the spread of this deadly virus. So first, let's talk about the number of cases that we have. So today we have 2,210 positive COVID-19 cases. We announced 139 new today. We have 121 total hospitalizations. Of that number, 33 are on ventilators. Unfortunately, we also announced 6 new deaths today, bringing that total to 71. And again, the only way I can offer my condolences and to make sure that these families and individuals who are affected by the loss of their colleagues and their friends know we mourn with you. You know, the personal information about all of these cases is private. I don't get access to it. No governor should or does. But I do want people to know that we mourn with you. It is incredibly hurtful to know that we lose anyone in this state to this unfair, deadly, invisible threat and virus. And we're doing everything in our power to reduce that number and to stay the course to the highest degree. What we're going to do that's a little bit different this time is I typically talk about what's new, what's happening, and I am going to do that because I think we have some both good news to share, and we want to give people a sense about what the next month is going to look like in the state. And as we prepare to do that, I want you to hear from Secretary Kunkel, who's going to talk a little bit about testing. I'm going to do a quick highlight because for those of us who spend too much time hearing from or engaging in national news, you might have heard this morning that many states are beginning to open up what they call surveillance testing, and there's been any number of statements that so-and-so is the first state or the second state. Your state, because of the work that you've done with social distancing, has allowed us to expand testing much earlier than the rest of the country in what we're calling surveillance, which means targeted populations so that we know what the prevalence is. And I want to really thank the leadership of Secretary Kunkel, who has leveraged that opportunity in any number of ways and places. As you will hear from Dr. Grace, I think it's really having an impact by giving us the kind of information where we know where risk is and what we're doing that's mitigating risk so that we can continue to support those kinds of measures. So thank you, Secretary Kunkel, and please give us a testing update.
Thank you, Governor. And good afternoon, everyone. The strategy that the Department of Health and the state of New Mexico used to expand testing, it really had 3 components. First, we attempted to expand our sites, and I have a slide, there we go. On March 15th, we only had 7 sites statewide. But as of today, we have 64 sites in all 33 counties. So that was an important initial strategy of ours, was to make testing available throughout the state. Secondly, we began to focus it on communities, and I'll talk more about that later, but we moved into a more focused approach. And then we had to increase our lab capacity, and I cannot stop thanking all of our private partners for assisting us with this. We now can test over 5,000 people a day when we are at our full capacity. Department of Health could not do that without TriCore and the national labs and our other partners who have assisted us to get there. But the strategy we moved into after we established the 60 sites around the state was to focus on targeted communities, particularly long-term care sites, long-term care facilities, some congregate settings, and tribal communities. We have been targeting these communities for weeks. We've been specifically in 35 nursing homes doing targeted testing for sometimes in response to a positive case and sometimes just to be proactive. But all long-term care facilities have received direction from the Department of Health to conduct surveillance. We provide the kits, we provide assistance, but all 74 nursing homes are now conducting their own surveillance. We also moved into tribal communities in a bigger way. We are out in 16 of 23 of our tribes. We have conducted testing. We will continue to partner with Albuquerque area and the IHS to get sufficient supplies and partnership to continue that. And last weekend, we began testing asymptomatic essential workers at the direction of the governor, and I believe we were one of the first states to do this. So over the weekend, we tested in Albuquerque, and since the weekend, we have been in every community under the 4 regions of the Department of Health, testing particularly grocery store workers, construction workers, healthcare workers, and people who are in direct contact with the public and are at most risk for contracting COVID without having symptoms. So we appreciate everyone's voluntary cooperation with this. It was a bit of a surprise in some communities. We could have done a better job perhaps of preparing you. We are deliberately testing asymptomatic people to see if there is silent COVID in our communities that we're not aware of. So this is moving on very well, our testing strategies. Our goal is to proactively and aggressively continue to test these at-risk communities and stem the virus. Thank you.
Thank you, Secretary. So now we're going to go to modeling. Typically, I give an update about what's been accomplished in a week, but we have a lot of, I think, new things to talk about. So I want us, and the reason we have some new things to talk about in the state is because the data that we're using, as you've heard before, we use New Mexico specific data. We use it every single day. We're using public health, scientific, and medical expertise in evaluating, including we've got both Lannel and Sandia Labs and private sector laboratories engaged in this modeling so that we really know what is happening every day and what we can predict that will happen tomorrow. And so I'm going to Dr. Scrace to talk about that modeling and show you some new data points, and then I'll get back to the rest of our presentation, and then we'll go to questions. Dr. Scrace.
Thank you, Governor. I'm going to start actually just by saying that I have some good news today, and then there's still some areas of concern. And hopefully we'll be able to see both and understand both, and we can hold both of those in front of us as we make decisions going forward for New Mexico. First slide, you've seen many times, that's the number of tests, so let's go to the next one. We're already over 40,000 tests, and I'm going to talk in a minute about how wonderful that is. Let's keep going. And one more. These will be available online for you. But I want it, next slide. This is on the right. You can see the number of cases in each county, and the darker colors mean more cases. We still have 6 counties that are gray, which means we don't have any reported or identified cases, but that's very different than being able to say there really aren't any cases at all, because we're now knowing through the literature, and it's controversial this week, but that for every one case we know about, there may be 40, 50 or more cases out there. And so that's something that we look at with our modeling. You can see McKinley County is the dark red county on the left. This is the infection frequency. And in fact, the rate of infection in McKinley County per person is 7 times higher than Bernalillo County at the present time. And so we're very concerned about the northwest corner of the state, just like we were last week, and we'll say more about that. We've talked a lot about doubling time, which is on the next slide. That's the amount of time it takes for a certain number of cases to double, but it's over the entire period of the infection. So this isn't the whole period. We cut off 12 days there. We started at 1.9. Now we're at 5.3. I think one of our senators sent me a question, but if I count back 10 days, it looks like our cases have just doubled in the last 11 days, and that's true. So our doubling time is really slowing, is really lengthening. That's really important. It means slowing the spread of infection. But we just use the epidemiological standard math that allows us to compare our doubling times to other states and other countries. So if you're doing math on your own, good for you. But it is, that's why it comes up 5.3, because it's from the beginning until now. More good news. The next slide is a new slide, and it just maps out for you 5 different counties. You can see Bernalillo County on the top. If you look to the right, the blue line, and you can see Santa Fe County on the right, on the bottom line there, green. And you can see 3 other counties, McKinley, Sandoval, and San Juan, the ones that we got our eyes on. What you notice about the green line is it has become almost flat. The number of cases is hardly growing at all. You can also see Bernalillo County on the top is getting there. So Santa Fe on the bottom, almost flat. Bernalillo on the top, about to flatten out. But the 3 counties in the middle in the Northwest still growing in their number of cases. And so we have a great trend on the bottom line there, a worrisome trend in the middle 3, and an encouraging trend for Bernalillo County on the top. This slide, and if we go to the next slide, this is the flattening the curves slide, and you'll see a squished down set of curves there that used to be quite high. And if you remember our flattening the curve model, we had a big high peak there, but this means what we're seeing here, and I'm going to walk through what each line means, or most of them anyway. What we're seeing is that we actually have flattened the curve for the whole state of New Mexico. Now, that isn't true for every region, and you already have probably figured that out. But let's talk, let's just look at the solid blue line going straight across. That's the number of available medical beds. And then the solid blue line on the bottom is the number of medical beds we'll need over time. We're still working on that x-axis and the timing of this, so don't take that literally. We'll have an updated version of that soon. But you can see we're going to have enough beds. The next one is ventilators, the red line there that comes off at about 450. We're actually finding ways to outfit new ventilators and use other machines to give us more ventilators. But our need for ventilators, given this flattened curve, looks like it will not be exceeded. And the only place where we appear to still may have some risk of going over is needing more additional ICU beds. Now, I want to issue a warning before everybody goes out in the street and starts celebrating. First, don't go out in the street and start celebrating, stay at home. And second is, this is just 1 week of data. And someone asked me this morning, like, last week it looked really bad and this week it's looking really good. How can that be? Well, one of the advantages of exponential curves is, while they go up exponentially, they also come back down exponentially. And so we are seeing some fairly rapid improvement here that's encouraging, but I think we need to wait, see what we get for our data next week, see if this holds out. But this is very encouraging news from a whole state view of things. To give you some examples of the sort of nerdy data that the modeling team, our 25 experts look at every week on Tuesday at 1, there are 2 graphs here. And we're really looking at things more on a regional level, but I've given you 2 county graphs. The black dots on these graphs are actual cases and the number of cases. There are logarithms in here, and I didn't mean for this to be a math class, but the shape of the curve still holds. Black dots are real cases, and then the red dots and the red line are what the model shows us is likely to happen over the next week or 2 in Santa Fe County. And you can see that the number of cases has gone up and it's come back down. And this is really good news. Santa Fe really should be the model for the rest of our state in how to do social distancing, how to persist in doing social distancing, and how to take really seriously the threat of spread of the virus when we go out. On the other hand, in San Juan County, you can see that the black dots are scattered, but the model shows not only is the trend going up, but in the next month, it's going to go up even higher. And this model assumes that no one's going to do anything different in either of these counties than what they're doing now. So it doesn't mean that San Juan County is doomed to have a rapidly increasing number of cases unabated. It means that as social distancing improves in that region, and we are seeing improvement in mobility data in San Juan County, that we can bend that curve like we have for the whole state downward again. But I just wanted to give you a look into that, and we will have more of this on the website, on the DOH website very soon. Now, the next slide is something I know everybody has really been wanting to see, and I want to emphasize two things. Number one, please insert the word draft criteria for reopening the health system, because we're not, this is just the very beginning of the work that we started doing this weekend when we saw some of the results of the modeling coming out. But the governor has asked the medical advisory team to carefully outline medical and public health criteria that we could use as a state to know that we might be ready to start doing some of the things again that we have not been doing for the last 6 weeks. A lot of detail on this slide. I know people complain when there's too many words on the slide, so let me just apologize in advance. But you can see here that there are a number of things that we really have to have in place to move forward and begin to reopen. And again, this is just from the medical public health point of view. So, of course, new case rates need to be declining, and we're working on the numbers for that. Our doubling rate also, we want to continue to be maintained. Adequate testing to achieve containment. I really wanted to just recognize two groups of people. The first group is our governor and Secretary Kunkel, who've just done an amazing job expanding testing in our state to get from being able to do a couple hundred tests a day to 5,000 a day is truly an achievement. And I think it may be one of the highest testing capacities, if not the highest in the state, in the United States, I'm sorry. And let me just reiterate to people why testing is so important. People sometimes forget, because when we test someone and we find out that they're positive, then we isolate that person. And then that person doesn't go on to infect 2 or 10 people, they're isolated. And that 2 to 10 people don't go on each to infect another 2 to 10 people. So the testing is what starts that, and the availability of that testing, which creates isolation, which reduces spread, which has flattened that curve. So 1/3 of the credit to the governor and Secretary Kunkel, and 2/3 of the credit to the people of New Mexico, because without the social distancing,
Right.
It doesn't matter how much testing you actually do, we could still have a kind of pandemic that we're watching on TV in other states. The third thing is contact tracing. You've heard a lot about that, and I just mentioned it. It's when we find a positive person, our epidemiology folks contact that person, find out every person they've contacted, put them in isolation to prevent the spread of the disease. Of course, PPE we're doing better on. When you flatten that curve, our requirements for PPE go down substantially because we won't have as many people in the hospital. But if we're thinking about reopening both healthcare and the economy, then more of us, everyday citizens, will need PPE. Hospital capacity, it looks like we're solving that problem, but obviously we can't open any area of public life again in a region where the hospitals are overfull. Healthcare worker safety and well-being is an important factor. There's data out of the East Coast that in some places 40% of the healthcare workers have become infected, so that's a factor. And lastly, and it fits actually with testing in number 2, an outbreak containment plan. This is an extension of what Secretary Kunkel was talking about with surveillance testing, but if there's a new area where we find 3 or 4 cases in one workplace or in one environment or in a congregate living facility or a nursing home, we can rush right in and do immediate testing and containment of individuals. And that has to be in place and has to be fully staffed and has to be fully effective to have any kind of reopening of the economy. I'm going to just throw out a quote from Winston Churchill. Those who fail to learn from history are condemned to repeat it. And I want to show you a couple slides about history that might make the point about what we have to think about carefully when we move forward. On the left is a graph. We have to go back 102 years for this, but this is the Spanish flu, the great influenza of 1918, 1919. And you can see that little bump on the left. That was the first part of the pandemic, and where 0.5% of all the people actually died during that. And there was a huge lockdown, and it appeared that the virus had become quiet, and things reopened. And then you can see that giant spike in the middle where 5 times as many people died in that pandemic as the first. And then got the epidemic under control again, tremendous amount of social distancing and lockdown. People relaxed, things reopened, another bump. And then if you don't want to go back 102 years, we can just go back to 11 years to H1N1 or the swine flu. This is just a graph from London because it was one of the clearest ones I can find. You can see the exact same thing. A big spike, came back down, and then relaxation, people going out and interacting more with other people, and a second epidemic. And we really do not want to do that. And part of the reason, if we go to the next slide, and almost my last slide, part of the, I'm a geriatrician, and old people are my people. I take care of them, I love them. It's really important to me. They're to me a symbol in this epidemic of one of a whole bunch of groups of vulnerable populations. I think most of us understand that our elderly are one of our most vulnerable populations, but so are people with diabetes, people with obesity, people who live in congregate living facilities, people with immune disorders, people with other serious medical problems. And you can see on the left graph that the distribution of cases of COVID by age sort of spans multiple age groups there, and just it's by groups of 10. They're not 10 years, they're not all labeled. It's what we call a bell-shaped curve in statistics. But you can see that the mortality rate, once you get 70 and above, goes from 8% to 21% to 28%. And none of us listening or watching today would leave our house if we thought there was a 28% chance of dying, unless there was a greater than 28% chance of dying if we stayed in the house. And so when we start coming up with ideas of how we can open things up more, every population is different. Every person is different. There is no one size fits all. And I just wanted to say that today, that we need to be careful. We don't want another whole peak and another whole new pandemic in New Mexico. And lastly, before I turn it back over to the governor, I just wanted to let you know that the MAT team and our behavioral health team brought up a healthcare worker and first responder support line. As you can imagine, being on the front lines, taking care of people, worrying about whether you're going to bring that home to your families, worried about whether you're going to get sick yourself and spread it to other people is terrifying. And our heroes in healthcare, our heroes our police officers, our ambulance and EMT support people are doing a heroic job. And we have a line there for you. If this is starting to get to you, please call. We have folks who can answer and get you connected with resources, or just talk it through with you that day as well. Thank you very much, Governor.
Thank you, Dr. Scrace. So a couple of things. One, Dr. Scrace not only is an amazing leader in this combating this pandemic, and certainly an incredibly successful Human Services Department secretary. He, in fact, at one point in time was both my parents' geriatrician and physician. So he doesn't get to do that. I lost my father several years ago, and he navigated my family through that, and is incredible, and spent a lot of time also being the physician for my mother. And it's really important, both in terms of having the expertise for vulnerable at-risk populations and for someone who understands, right, these public health modeling aspects, to be engaged in public policy in New Mexico. And I will tell you that while the biggest things, because this really in large part is good news, although it's scary, every time I see a graph with any kind of a peak, the only thing I think about as governor is how many people are negatively impacted by that peak. How many first responders, how many healthcare workers, how many hospital beds, how many deaths, how many families forever changed, and that's my job and responsibility, protecting as many New Mexicans as I possibly can. But it's incredible to have the kind of experts who are helping you navigate or thread that needle in a productive way. Not every state is engaged in public policy. They don't have that same opportunity in the same way. And I want New Mexicans to feel, I hope, both confident about what we do, how we make decisions, and then also know that we have real empathy about just how tough this is, and that this is a fight that we're all in together. And make no mistake, it's a fight. We will fight this virus every single day. It will never end until there's both a vaccine and a treatment protocol. And without those two things, every member, every resident, every region, every county, so whether you've got a couple of cases or no cases identified in a rural county or in a region of the state, does not mean that you're not in this fight against this virus. And quite frankly, it absolutely doesn't mean that that virus isn't living among you and is a moment away, a transmission away, a contact away from infecting someone who's vulnerable and could in fact lose their life. And it's not just older people and senior citizens. This is a state that has also higher than national average medically fragile children, autoimmune disorder in young people, and related chronic care conditions, including diabetes, among an adolescent population. That makes all of those young people and children incredibly vulnerable to this vicious virus. So we have an obligation to be really clear that we're protecting all of those populations and that we're going to do everything in our power. All right. So is there good news there? There is incredibly good news, and I want to talk about that. But I also want to give you an update about the things that we're doing as a state all together, making a difference. So you heard a little bit about expanding the testing criteria. Why am I bringing it up again? When we do what we're now calling surveillance testing, I want New Mexicans to get really comfortable with the ideas that there are two kinds of surveillance testing. One is, right, we're looking for the virus specifically, active. Are you positive or not? Because then we can immediately socially isolate those individuals who are positive, and we can go after individuals who are likely, right, exposed, and make sure that they don't have the virus. I mean, this is the way that we really work diligently in stopping the spread. That, partnered with social distancing and limiting where we go, where we can go, makes all the difference in flattening this curve, which we have done as a state. The second kind of surveillance is critical in the context of knowing everything we can about the prevalence of the virus, immunity to the virus, and being able to assure both consumers that as we look at economic recovery, are you safe to go in to a grocery store or a business? Are you safe to visit a neighbor? We need to know about the prevalence. So how do we do that? And that workers in businesses are safe. Well, we do that by really doing this serology testing. I know that we've introduced that. I know that most of you probably by now are experts because it's been widely talked about in the national media. That's a good thing. All right, so this is using a blood test that's looking for antibodies in the blood that would suggest that you produce those antibodies in attacking your body, the virus, and protecting you. That gives us some information so that we can figure out how prevalent it is, where was it, and we can start to look at immunity factors, which is data that the entire country needs. Because, you know, we were guessing about criteria for transmission. We were guessing about how long the incubation periods are. You stop guessing and you use educated guessing models with evidence-based practices and researchers and physicians and public health experts. But until you know exactly who's been exposed and exactly how many people have antibodies and exactly how many people have the virus and what age groups, you don't have enough information to make the next set of decisions. So New Mexico is going to embark on both. So we've decided, based on FDA approval, and remember we talked about being a pilot state with several other states, including Nebraska and Texas, in what the federal government wants to pilot expanded testing, which we talk about in this surveillance model, and it's both sides of that equation. It's the antibody testing, and it's still going after who has the virus so that we can isolate those populations as quickly as we can. Now, I can't say that we've gotten all the supplies in, but we've got a strategy for identifying what FDA-approved serology tests we need to buy. We're going to diversify, like we have in the testing kits that we purchase and use and the instruments we use to actually look for, when we do those nasal swabs, to look for the actual virus. And we're going to keep asking for those supplies so that we can expand both at the same time. It is crucial to making smart, productive decisions about both economic recovery and protecting our population, right? These things have to be done together. You don't get to choose one or the other. And in fact, if anyone tells you you have to choose one or the other, and I wrote an op-ed about this, it's a false choice. right? You do one thing, you bulge out a problem someplace else. You aren't solving things. We're going to be a state, and have been already, at doing parallel decision making, looking at essential businesses and economic recovery, and being completely clear that we will attack this virus and keep people safe, and that's how we're going to make our decisions. So I'm excited about that. We've also, I think, are getting close to identifying what automated tools and strategies. We will do that with the federal government for contact tracing. You might imagine that if I am COVID-19 positive, and I am not, that then I have to think about everyone that might have been in contact with me. And then we've got to call all those individuals, and I have to keep thinking about it. And then I have to think about where I might have been, where I didn't know anyone, but they could have been exposed. And it is a really arduous effort. And we do it every single day for every single person who tests positive. And I have to say that New Mexicans have been really productive and compliant, but it takes a long time. And you add that to testing times, and it's too long. An automated aspect allows someone to get a text, gives us a sense sort of geographically about who might be exposed. No private data goes anywhere. No one knows who is who. It's just getting a sense about who might be exposed so that we can get you tested, and then we know. We think that Accenture, which is a software product and company, could be one of the tools, if not the tool, that we utilize. So we're in a testing phase right now and looking at if that's the decision we're going to make. So I know people are really interested about how that pilot's going. Last thing about the pilot, we want personnel on the ground. So we're going to get public health personnel. I don't know whether they're from DC or from Texas, and we'll figure out the right social isolation and self-imposed quarantining. It'll be shortened because they're already doing that, and a lot of it can be done using the internet and telework, telehealth aspects. But we think this three-part effort really sustains a recovery in any number of ways. Keeps us safer, that's a recovery. We're winning the fight against the virus, it doesn't transmit, it's not moving quickly through the state, that's a win in this fight, and it allows us to talk about economic recovery. We've got, and do I have a slide for this which shows some of the other things that we're doing? Was it up? I think it was. Put that back up. And if you get, there we go. And I'll go through it much more quickly. I just really want us to understand where we are, which is great, and where we're headed. We have 537 New Mexico National Guard men and women up and ready for action. Thank you to all these individuals who are defending our state and protecting us and our country. They're amazing. And I want to tell you that I think 57 of these individuals are in, for example, Gallup right now. This is about moving resources to places where New Mexicans need us. So we're doing that. We have stood up one centralized decontamination unit for PPE. What does that mean? Remember, we talked about hydrogen peroxide and ultraviolet light. We're doing any number of things, but now we're making sure that smaller communities that may not be able to do that effectively, but we can move it, decontaminate it, and move it back. You can't do that with masks and other PPE forever, but you can do that a few times, and it really makes sure that we're leveraging our personal protective equipment, because our healthcare workers and our first responders have to be protected. We've delivered 404,000 pounds of food to the Navajo Nation, Jicarilla Apache, Mescalero Apache, and the pueblos of Zuni, Zia, Picari, Santa Ana, and Laguna. And I want folks to understand really what's occurring. Look, these are communities that are working incredibly hard to self-contain. That helps us, right? We don't spread the virus. It's incredibly challenging. It shows great leadership in those communities. But it means that they don't have access to essential goods and services. We have to bring them to them, and there are many of these areas that do not have running water, clean water, access to water, and electricity. So we have an obligation, every New Mexican, to support and serve and protect every New Mexican. So we are doing that, and I want to thank the men and women who are helping us do that. We are establishing safe COVID practices and placements for long-term care residents and for folks who need behavioral health assistance, and detox, really critical in New Mexico, and that is occurring. And we are accelerating. I already talked about our readiness for Gallup and Albuquerque. And one thing people keep asking, what about that 200-bed hospital facility? Here, it's 50 of those beds and personnel and all of the related pieces of equipment go to Gallup. The rest of it's going to be stood up, as we talked about at the Gibson site. It's here. I know folks were interested about when that was going to happen. It has happened. All right, next steps. Here's where we are. I want folks to be really clear. We're not out of this fight yet. We're not out of the woods yet. Why? I'm going to remind you again. Until we have a vaccine, this virus lives amongst us. And it's looking for hosts. So it's waiting for you to show up at a business or a long-term care facility or an emergency room or a grocery store or a neighbor's house. This is exactly how it creates havoc and harm, and it's a virus that has caused a global economic near collapse and has created significant economic challenges for states like New Mexico. It is all this virus. And so our successful fight against it means that we can recover. So, first thing, you should expect in the next couple of days or so for us to extend our public health orders through May 15th. I'm going to guess that that is not news, particularly with that flattening and how well New Mexicans are doing. I mean, you're doing an amazing job, and everyone thanks you. But if we don't do that, as we've flattened, we will shift that immediately to a peak. We shift it to a peak. We can't mobilize our resources for areas where we have containment issues and real challenges, including the northwest region of the state. And I think there are other regions that have likely risks in that of that nature. So we got to be ready for them, and we have to support them productively. 2, what's our best defense? Social distancing, all right? But what can we do to both look at economic recovery, to stay in the fight productively, and to give a sense to New Mexicans that, including everyone at this press conference, some relief valve, right? What is normalcy going to look like? It isn't going to look like it did in January. Right? We're not going to be congregating in large groups at parks, and we're not going to be going to huge concerts. I don't think that's going to happen anywhere really in the country. I think that those are going to be shifted. I think we're going to be wearing masks. I think people are going to be wearing gloves. I think the way that we operate businesses, you should expect that aspect. We're going to still try to be socially distanced, right, from each other, so at least 6 feet apart. You should expect that that's how things are going to be until there's a vaccine. But we can ease up a bit. So here's how we're going to ease up. You already saw us lean in a little bit, and I've got a slide up, and I want to talk about this. This is a phased approach to reopening the economy. And you can see that we're in the navy blue or dark blue phase, and that's the preparation phase. And we've eased into that a little bit. We said flower stores and nurseries could do curbside and delivery. So again, you still have people delivering and you still have people driving to a nursery, but we're still minimizing, right, exposure to individuals at a particular business. But we're signaling that we want a little bit of economic recovery and a little bit of support to individuals who want access to those services. All right? What else does it mean in this preparation phase? Right? We are creating councils to help us design an economic recovery effort. And I want you to keep this slide up, and I'll cue you when I'm ready to show the individuals that are going to be on our Economic Recovery Council. Here's the statewide strategy to do this productively, because we're going to need everybody helping. How do you help? Stay home, where you can and when you can. And 2, I will have an Economic Recovery Council that I'm going to show you in a minute that is going to work with me directly as the governor to figure out what businesses could open, How do they open? What public health practices would they have to be able to commit to? Gloves, masks, temperature screening, any number of things, surveillance, testing, all of those, some of those, right? We're going to decide those using a public health evidence-based model, right? So that these parallels stay. We don't abandon one for the other. 2, we want a council of mayors, bipartisan mayors. They will work directly with the chief of staff in my office, John Bingaman, because local government, right? They license businesses, they're hearing from business owners, they're leading the state. They have been also particularly responsive and responsible for flattening the curve, and they need to be part of continued success. I thank them for their leadership. We're going to keep doing that. Every member of my cabinet will have no more than 5, probably around 3 is the average. They'll have economic stakeholders. So economic development, tourism, even the Department of Health will have healthcare leaders, right? Talking to us about these parallel efforts to make decisions about how you open up businesses, what does it look like, and how do you phase it in? All right, and then what would phase 1 look like? Well, you heard that even though we're all going to stay home through March 15th with easing some restrictions, giving a little more access, I think for vulnerable individuals, we ask them not to lean into any of our easing of any restrictions or opening up of any additional businesses, because if they don't stay home, they're at the greatest risk. We want to do everything we can to protect them, but what else do? They create more hospital care responses, right? And that's the other thing we have to be mindful of. All right, I already talked about it. You can see some non-essential businesses, right, could then be opened up. And we have to figure that out, and we're going to create these standards and protocols for them to do that. Certain businesses in phase 1 are likely to have to stay closed. So can't all happen at once. And then phase 2 and beyond, you can see that, we're going to add up additional businesses. We're going to figure out what those are. We're going to keep broadening that scope. We are likely going to lean into large gatherings and events. I already sort of highlighted that, are likely not to be promoted, or they may stay in a restrictive public health order. These are the areas where you have the greatest risk. And it's going to be an issue, quite frankly, for the whole country. And then we just have kind of the other category. There are going to be things that we learn every week. And so we need to be ready to make those decisions when we have the data. All right, let's go to who my council is, because I really want to show this. All right, you can read this council. You can see that they're all going to be on a website. I want to thank the men and women who are willing to help New Mexico get this right, who have all been either directly affected and impacted by the economic slowdown, by the small businesses, some of them may never recover. That is as painful as anything else that has occurred in this state. That's not what anybody here wants. We need to do as much as we can to support them. This is an economic recovery council that can do that. So you can see we've got small business, we've got rural business, we've got grocery stores, we've got big business, and we've got a healthcare expert. What you should be, we've got someone that represents workers. What we have here is a representative, small, medium, large, geographically balanced so that we're looking at those issues, and they fit nearly squarely with our economic priorities as a state, right? Everything from film to renewable energy and value-added ag, everything in between. So this is a productive cross-section, and I specifically want to thank our co-chairs, former Representative Brian Moore and Christina Campos. I am really excited about their work, and our job is to do so much, so furiously, that we hope to give you good news and strategic efforts every single week through May 15th. So again, I'm very excited about the announcement of this council, and I have no doubt that we are going to get this right in New Mexico. Last thing to talk about. I know that at least I'm getting a growing sense that while we are really to be congratulated, look, The strategy of every single state, every jurisdiction, every community was to flatten the curve. We did that. I do not, and I want you to celebrate in your house with your family, and I want you to practice masks and gloves if you have them, when one of you needs to go out to the grocery store. It is too early to stand outside and feel like we won. It's an invisible threat, and it's still there. We cannot focus on the northwest region of the state and other regions that are going to have similar issues unless we keep that curve flattened. There was a data point from a day ago or so where one patient every hour was being transported from the northwest region to a healthcare provider in Albuquerque. And I think people really need to understand that this is a really serious effort, and it requires all of our support and all of our attention. Gallup needs every New Mexican to do everything they can so that we can slow the spread, get through that peak and start to come down. Same thing from McKinley County. It's that whole region. The whole region needs to work together, and the whole state needs to work together. You have our support. You have every New Mexican who's pulling for you. We are going to get through this, and we're going to go slow, productively, proactively, steady, and we are not going to be pressured by nuances in other states. We're going to focus on what's right for New Mexico, and because we do that, New Mexicans, we're going to get it right. We've done a really incredible job so far. So thank you. I know we went longer, but I hope that this is feeling like good news, because it is. And that we are now in that preparation phase to begin to get as close as we can to a life that we embrace and an economy that is supported, that is moving forward, and that has some predictability about the future. All right, thank you, New Mexico, and congratulations. All right, let's take questions, Nora.
Thank you, Governor. First, we're going to go to Chris McKee with KRQE. Chris, you are unmuted. Go ahead and ask your question.
Hey, can you hear me?
We sure can. Go right ahead.
Okay, thank you very much. Sorry for the delay there. I just wanted to ask, I guess simply put, should New Mexicans be prepared for closures and really a difference in the normalcy of life for the rest of 2020? It really feels like that in some ways when hearing some of the information that exists out there. So I guess simply put, should New Mexicans be ready for a lot of different changes throughout the rest of 2020?
I do think New Mexicans should be prepared that it's not going to be like it was pre-COVID-19 until there's a vaccine. I mean, that's fair. I think the frustration, Chris, is that everybody wants to know date certain. When is everything open, and when can I just go outside? When is everything? I can't answer that. No one can. Because until I have a treatment and a vaccine for this virus, I can't do it. No one can. But I do think New Mexicans, because there's some trepidation about that. So it's never going to be like I remembered. We're not going to have 200 people congregating in a park and all of the great festivals that this is a state that's known for. That just feels wrong. I don't want people to give up hope that none of that ever occurs. I just want folks to know that we have to be really prudent and vigilant in this fight against this virus. So to answer your question, yes, vulnerable populations in particular are going to be instructed to stay home. Other populations are going to ask to be prudent as we expand access to services and businesses. We're going to ask businesses to help us do good public health practices, masks for employees, gloves for employees, temperature checks, surveillance testing of one kind or another. And if we do that together, and I know that we can and we will, then New Mexicans can expect relief from the kind of social isolation that we've asked them to put themselves under, which allowed us to protect New Mexicans and protect healthcare workers and first responders. So it's a bit of both. I don't want folks to feel like what they know today is what it's going to be like next summer. I don't want folks to feel like that we can lift every restriction in every context, because once you do that, those Spanish flu pandemic charts, you know, they had a parade, people celebrated, many more people died. We're going to have to be really cautious about that until there's a vaccine. Dr. Scrace.
Governor, I have nothing to add. I think
Oh.
the vaccine is the end game.
It is.
Ultimately, we all have to be immune, or almost all of us have to be immune to have this go away, which is either through vaccine or having it. And I think that the tricky part in this is, as things open up, we still have to maintain the same social distancing.
Yeah.
I think one change that will be with us for the near future is that everyone will be wearing a mask when you go out. Everyone, not just employees with gloves and masks, but everybody will be wearing a mask for quite some time until we're all immune. And I think we're trying to put this strategy forth with all of your help to have us all get to that time where we can get the vaccine to be immune, rather than having vulnerable people have to go through having the infection to be immune or risk death.
And I know we've got other questions in the queue, and we want to get to them. But you know, this is masks are something we're not accustomed to, and I'm learning my own self. And you know, we've got very strict protocols for our staff, very strict protocols for wherever I go, including even, you know, my security detail. They're required to wear masks and gloves, and we take that very seriously. And it's a whole new practice that we have to get accustomed to. And here's how I think about it. Not only am I protecting New Mexicans, but in fact, I'm helping promote the opportunity to support a local business. Because if I do this, it means that their employees are safe. And if their employees are safe or safer, that means that they can stay in business longer, or they can start to be in business. So that's how I think about it. I have a role, just by having access to this homemade mask, I have a role in promoting economic resiliency and recovery. And you know what? I'm willing to do it for those reasons. And so New Mexicans should expect, we're going to expect that you do this to help us successfully have more economic recovery and more and also to create transmission and virus containment strategies that are productive. So that's something that New Mexicans should expect. Next question.
Thank you, Governor. Next, I'm going to go to Julia Goldberg with the Santa Fe Reporter. Julia, you're unmuted. Go ahead.
Thank you. Governor, I have two quick questions. The first was about the...
Julia, I muted you for just a sec. If you can turn down your volume in the background so we don't have feedback. Thank you so much. You are unmuted. Go ahead.
Governor, I have two quick questions. The first was about the company you're working with on contact tracing. Did you say that was Accenture?
I did.
And is that the company Massachusetts is also working with?
It is.
My second question relates to the serological testing. I've been reading that those tests might face some of the same availability as the diagnostic counterparts had, and I was curious if that is what you're expecting, and if so, what the strategy would be.
Yeah.
Thank you.
Oh, and I tried to answer. I'm sorry I did that, so I'll do both now. Yes, it is Accenture. It is the company that Massachusetts is using. Good news about that is, you know, we know how it works, and they can give us a review. We also know what challenges it's presented, so that we can ask them to address those here. I want to be really clear. We haven't made a decision, so I don't want any New Mexican to think that that's done. But we are really testing that software for contact tracing, and so far so good. We also looked at other software companies or packages that do that, software tools, I guess I should say. But right now we are in the midst of testing Accenture. So that's one. And two, yes, I have no doubt that there's going to be a mad dash for serology testing. And let me tell you all the negatives about that. One, we are already seeing what I think are high stakes, high risk for serology testing. We've got all kinds of things going on all around the world. We have a test, it's FDA approved. Here's our FDA, right, letter or stamp of approval. Not true. It's a complete fraud, so we have to be really careful about that. That's why our medical advisory team has identified 3 different both companies and products that we know unequivocally are FDA approved, because if you get false...
There's an update from Governor Michelle Lujan Grisham on the coronavirus in New Mexico. As you just heard, we are now at 2,210 confirmed cases of coronavirus and sadly 6 more deaths. So we are now at 71. She also extended the stay-at-home order until May 15th, but she said we are flattening the curve somewhat, and she says social distancing is working. And about 15 minutes ago, you saw on your screen, she's also formed an economic council, statewide organization to try and get our economy back on track whenever the stay-at-home order can be lifted.